Ma'am, I'm sure you've heard about what happened over the weekend and the last few days na binigyan ng bakuna without FDA approval yung mga miyembro, at least ilang miyembro ng Presidential Security Group. You've always been concerned about vaccination and vaccine confidence, among other things. I'm wondering po how you reacted to this story na nagbigay ng bakuna ang gobyerno ng walang approval ng FDA.
Well, as you know, Ed, our Philippine Foundation for Vaccination and also the PMA, the PIDSP, the PPS, the medical communities, we are all one in saying that number one, the FDA is the only body that should really take care of authorizing our vaccines, drugs, and everything about registering these drugs. And number two, that we should all listen to experts, especially those who have worked so hard, qualified for vaccination, for vaccine trials, for clinical trials in vaccines, because this is not done overnight. Dapat marami ka talagang qualifications to be able to really look at the vaccine, what vaccine will be appropriate for the country, what vaccine will be able to generate the same effectiveness, hindi lang efficacy. Effectiveness is also something that we have to look out for. Kasi yung efficacy sa trial lang yan makukuha eh.
Okay.
Pero pag effectiveness, it's in the real world. You have to really look at how many can be vaccinated. So,
Yes,
importante yan. Ang opinion namin dyan lagi, yan. Number one is listen to the FDA. He is the only agency, and then listen to other experts, whether they are the medical, the experts, the scientists, the academicians.
But having said all that, we go back to that point nga po na the FDA never gave authorization and is apparently left holding the bag. From all indications, and naglabas ng statement kahapon ng FDA na na wala silang kaalam-alam, and they also warn that they have to enforce the law. Pero next steps po, what should be done now? Should people be held liable for what appears to be unauthorized vaccinations? And ito po, number two, given everything that you said, the need for vaccine confidence. Number two po, kung wala pa rin pong FDA approval for these vaccines, should these vaccinations by the government be allowed to continue? For example, kung hindi pa tapos yung vaccinations ng PSG, for example, kung first shot pa lang, kasi two doses po normally yan, di ba? Kung first shot pa lang nabibigay, should they be allowed to give a second shot? These details po.
Actually, tama kayo, Ed. Marami ka nang in-interview. Iisa lang naman ang naririnig kong sinasabi ng ating DOH at saka ng ating mga public health people kagabi, di ba? Ang sabi nila talaga, ang FDA lang ang dapat. Pero ngayong nangyari ito ang sinasabi ko sa yung vaccine resilience. Anong gagawin mo ngayon? Ang gobyerno natin ay napabalita na nagbigay ng bakuna. So, dapat sumagot sila ngayon dyan. Sumagot na si Dr. Domingo, di ba? Si FDA chief. Ang sabi niya talagang sila lang. Pero mag-iimbestiga sila dyan sa kondisyon na yan. At tinatanong nila, saan ba nanggaling yan? Definitely, magkakaroon niya ng maraming espekulasyon, di ba? Matagal pa yan bago magawa ng final outcome. Pero while that is going on, sabi mo nga, magbibigay ba, magtutuloy pa? Ang panalangin ko ay hindi. Dapat adresan na muna nila. Total, ang kanilang purpose, from what I heard, is para mabigyan ng safety yung presidente.
Safety cordon ng presidente.
Diba? At naiintindihan ko naman yan. Ikaw ba, naririnig mo rin naman yan? For the sake of national security, narinig ko yan kay Chief Durante. National security, ayaw mong magkaroon ng sakit yung presidente. Kaya iko-cordon sanitaire mo, diba? Yun, parang yun cordon sanitaire. Sila na lang ang magiging risky para maproteksyonan ang presidente. Kasi nangyayari yun, di ba? Si British Prime Minister, si Trump nagkaroon. Buti nga tayo, hindi pa nababalita si presidente. So it is important. I mean, we have to take in all of this into perspectives, di ba? Kasi mahirap din sabihin, national security, ayaw mo magkaroon ng presidente. Willing yung mga PSG na mag-risk. Alam nila yan kasi I'm sure, alam nila na talagang bawal ang unregistered drugs at vaccine. O bakit nila binigay? Bakit nila kinuha? Meron na rin silang, kumbaga, may spectrum na rin sila na mukhang safe naman kasi nakita nila ginamit na sa iba.
So, for example, as far as you're concerned, as far as your foundation is concerned, the Vaccine Foundation, should government discontinue giving these unauthorized vaccines until the FDA gives it a formal approval until dumaan siya sa proseso?
Yes, definitely. At bigyan tayo ng magandang explanation. Kasi kung baga meron naman yang dahilan. Sabi nga, nakikinig naman ako These are difficult times. These are different times. Alam mo, even in the beginning of this pandemic, nag-usap-usap na rin yung mga researchers. Paano tayo makaka-produce agad ng gamot? Paano makaka-produce agad ng vaccine? Kasi pandemic, this has not happened before. This is the first of a kind, unprecedented. So I can imagine the competition for the vaccine. People are really trying to get survival of the fittest. Ang mga leader ng gobyerno talagang mag-aagawan dyan. At siyempre, ang pinakamasaklap na hindi sana dapat mangyari, mapolitika yung vaccine. Kasi ang dapat manaig yung science. Yan ang pinapakiusap namin sa mga tao at sa mga policy makers natin. Ang manaig ay public health and the science of it all.